share of challenges, and that much we acknowledge. But getting to people regardless of their location should not be one of them. It will not be one of them anymore, Minister Mkhize. Even if you are in the mountainous Matatiele or Lusikisiki, we will get to you. No matter how treacherous the roads leading to your village, we will now be able to get to people in need of medical care. We have another gesture. Altronexus, a tech company based in Johannesburg, has also donated 200 two-way radios that will be used for communication by teams in the frontline service fighting the COVID-19 pandemic and beyond. The radios, which work on a GSM cellular network, will be distributed to each district for allocation to the teams that will operate the scooters. And the radios work on a basis that teams within a district can communicate with each other, as well as team leaders across districts. We're grateful for the donation, as these two-way radios will help our team stay in communication. This is truly the spirit of Tumamina and Ubuntu. Some companies have realized the need to work together and have donated the department as we continue fighting the coronavirus. One of those companies is Maraphones, a KwaZulu-Natal-based company which has donated 100 headsets which are produced locally. We are very grateful to have received the donation. Samsung has previously also donated 260 handsets. We appreciate all the help and assistance we have received thus far. If these companies continue working with the government, we can achieve a great deal together. Indeed, working together, we can do more. We're calling on other companies to do their bit in helping us ensure we deliver effective and efficient services. We're also improving our EMS, and we will continue doing that. But ladies and gentlemen, our ambulances crews have been under siege from criminals who have targeted them. That has to end, because when ambulance crews are attacked and robbed, that will disadvantage the whole community, as no one will willingly go to the hotspot areas. We have to call thugs out and report them to law enforcement agencies so that our EMS crews can continue doing what they do best, taking services to people and saving lives. We cannot have a situation where we have no-go areas. That is unacceptable. Those attacking EMS crews are our brothers, sisters, and neighbors, and we need to stop burying our heads in the sand, but speak up when we witness such attacks. People can report to the department or the SABC anonymously. Minister Mkhize has been in the province, monitoring our response to COVID-19. We were in our Tambo district yesterday, and I'm happy that the minister was happy with the work being done there. And that district has turned things around and must continue with its diligent work. We're also targeting Amatole district, in particular Mnuma Hospital, and even there we're managing to turn things around. But unfortunately, our confirmed cases of COVID continue rising. And when we look at that, looking at 7,868 confirmed cases, recoveries of 3,647, and 178 deaths, we get worried. To the families and friends who have lost their loved ones to the pandemic, we are sending our deep sympathies. May their souls rest in eternal peace. One death is one too many. This is why we want to also call on people to continue adhering to the lockdown regulations by washing their hands with soap and water or sanitize regularly. Wear masks or cloth masks whenever they are in public and practice social distancing. It is up to one of each of us to stop the spread of this virus by staying at home. We have seen how some people have put masks on their chins instead of covering their mouths and nose. And by no means it speaks to us when we speak to you, because we have been specifically requested by those who say because of their disadvantages, when we were mass addressing them on TV, they are not able to read our lips. Ezinye izinto asifuni timing mzwakuthi. Masincede sizinxibeni imask ngalo lonke ixesha. You should not be policed for you to wear your mask. This is not about beating the system, as abanye abantu seem to think, but it is about saving lives. Let's all please play our part so that our hard-working and dedicated nurses and doctors will not be overwhelmed. I thank you. Ndiyabulela enkosi.
Thank you very much, Minister. I'm not sure if the Honourable Minister is want to have the...
Thank you. Thank you very much. Let me see the Superintendent General in the Department of Health, Dr. Mbengashe, the DDG in the Office of the Premier, Sekwase, other senior officials, members of the media, good morning. We have come here to witness the launch of the motorcycles which are being introduced in the Eastern Cape to make it easy for community health workers to reach out to the most remote and far-flung areas, to be able to overcome the very difficult topography wherein some people live on the top of a very steep hill and others are at the bottom of a very deep valley, and therefore finding it difficult to reach the areas where the health assistance is possible to get. We want to congratulate the MEC for the initiative, and we believe that this is a pioneering effort that should be adopted across the country, where a lot of other parts of the country are facing the same challenge. Those motorcycles, those scooters, make it easy for someone who has to walk from house to house, ensuring the health of the people. And these cycles, the scooters, make it easier to save time and also energy as we move from one area to the other, because it can be quite a challenge to move from the bottom of Mbashe River up to the top of the valley, and therefore the exhaustion and so on is now overcome. But what I found to be quite nice is the innovation about it, that it can in fact be converted into an ambulance that can carry someone who needs additional help to be brought to an area where it's easy to access ambulances. And in addition, it can also be used as a mobile clinic for one person. So you've got a health worker, maybe a nurse, a public health nurse who will be walking around in the various parts of the country, and therefore they could actually set up a small post where they could look at people and assist them. So I want to say thank you very much for this initiative, and would like to encourage the other provinces to have a look at it, and so we will be discussing it as well to make sure that it can actually be of use in different parts of the country. Of course, we thank the companies that make other donations, such as the ones that came with the two-way radios. Communication is very important for efficiency in our health system. Mobility, that is transport, is important, but also communication is also very, very important. And I think this one helps quite a bit, particularly as it will make it easy for people to call out for reinforcement, for assistance, and for other forms of support that they might need. And the fact that it's something that can work in a difficult terrain such as this one makes it actually even more advantageous. So I want to say thank you to the team from Altron that has come with this contribution. We have also acknowledged the assistance from the Maraphones who are based in Devon, who actually have made also a donation, as well as Samsung and Telkom, who also gave us some other assistance in the past few months as well. to assist us also with communication. We've needed a lot of communication support as we do tracing and tracking of the contacts of those who are positive, and therefore, communication becomes one of the very, very helpful tools that we require as we move on. We have also noted that the MEC has brought on board additional fleets of about 15 units of mobile vans which double up as ambulances, and in this case it's very relevant because we have been to hospitals where the staff has requested to be supported with ambulances that are dedicated, and these are areas where the issue of the terrain makes it difficult for the ambulance response time to be within keeping to their needs. But in addition, there are also those that are close to the very busy national roads and which are prone to accidents. And some of them are, like, for example, the area where a bus that crashed into the ravine and killed a number of people. And so the feeling was that there's a gap in the supply or availability of ambulances. So we thank you for that quick action. MEC, we had a long discussion yesterday about looking at how to reallocate these resources. So this has really come quite timely. I think all in all, we need to be saying to ourselves that whilst we are facing a challenge of COVID-19, our focus should be on how to strengthen the health services in general. And therefore, as we respond to COVID-19, we respond in such a way that whatever investment we make, it must last us for a long time past COVID-19, and that we use the pressure that is coming from the COVID-19 to improve our health services, to close the gaps, and to make sure that by the time we are able to give a full and strong response to COVID-19, we have actually improved our health services. So that is the approach we are taking on everything we're doing, and that is to make sure that whatever we've seen as weaknesses in our system, as we correct them, we're correcting it with a view that it must last longer than the crisis. And so it begins to help us as we move towards the future of the national health insurance, where we should have a much stronger, community-based primary health care system, where we are able to make sure that we can account for each and every individual South African's health, visiting them in their homes and making sure that they have got access to medication, that they have got access to prevention, health promotion, immunization, and continuous monitoring of their conditions, so that we can find out early, if people have got any diseases. So screening of diseases and early interventions, early treatment becomes important. Also linked to our program of the supply of chronic medication, which we call CCMTD, which basically means we make available medication to people closer to their homes, even if they didn't need to go to the hospital, or even if they went to the clinic, they quickly get their medicine and go home if they didn't need to see a doctor. All of that becomes part of what we have to do. Now, we have yesterday indicated to the MEC that we were starting a program to train community health workers to work on the prevention of the non-communicable diseases, in particular the cardiovascular diseases, blood pressures, heart failures. All of those are very big challenges in the communities, and they are now being referred to as silent killers, such as diabetes. So we now need to balance the two, on the one side on the non-communicable and the communicable diseases, in such a way that we can account for the good health of our people in their community, even if they are not able to reach to a clinic or a hospital, because we are able to reach out to them. That, for me, is one thing that is very, very important. So in addition, therefore, I would like you to, MEC, to tie up all of this together You got now your scooters. You're going to train your community health workers so that they can manage them. Then we will have some two-way radios which will be put on top. Then we will also like you to link it together with the blood pressure machines that must be available. So someone who is out there and is on a kind of safe lockdown, because voluntary lockdown, because they are avoiding to be in contact with people who have got COVID-19, they can have their blood pressure checked. And if the blood pressure is under control, then of course the community health worker can deliver the medication. And if there's a problem, they should be able to report immediately so that they can get attention. That's going to help us to balance and stabilize a lot of our people out there. I think it's also important to say that whilst we are concerned about COVID-19, which is a serious problem and a new infection that we're all very concerned about, it's also important to say that there are a lot more other diseases that are causing mortality out there that we can't ignore. And we can never actually create an impression that it's fine to be safe from COVID-19, but then you can still succumb to another treatable ailment such as diabetes, hypertension, and others that we have to deal with. So the alertness of our health workers is to keep the balance, to make sure that we still make the point that it's the overall health of our people that we are concerned with. Yes, COVID-19 is a very serious problem, but we can't ignore the rest of the others, which were there long before COVID-19 and have actually caused huge amount of ill health and mortality amongst our people. So we would therefore want to ensure that this program is piloted in the same area so that we can quickly see the results of this. And at this point, we have acknowledged we've got 10,000 community health workers who can be put onto this training with PP cuffs, and so we're going to be moving on to try and see how to get additional assistance to load the diabetes area, as it were. But of course, 10,000 is the total that we've got. It's not for the Eastern Cape. If I may just make sure that your numbers are correct. So we will therefore do a proportionate distribution, and therefore will indicate where these are going to be available. Having said so, I think we are facing a serious challenge as a country. We're facing a challenge of the rising infection of COVID-19, and this rise is something that we did anticipate would happen. However, we still have to mount a strong campaign to make sure that the increase in the numbers is not as rapid as to be out of control, because our major issue has been around how to make sure that we reduce the rate of spread of the infection such that we are able to cope in our hospitals, in our facilities. We have increased the numbers of beds and put up field hospitals, but as we now are looking at our numbers, we need to then make sure that we continue to increase those numbers further, just to make sure that we don't end up in a situation where we have more patients landing up in our hospitals than we've got beds for. And so as we move around in the different parts of the country, we can see that the numbers of patients who are hospitalized have increased in the Western Cape, largely in Gauteng, and in the Eastern Cape. And so there is going to be a huge demand now for additional beds, particularly in the ICU and high care areas. And yesterday I had the opportunity to view some of these renovations where high care beds are being introduced, where ICUs are also being introduced in the different parts of the Western Cape. And I really want to commend the province for that effort. It's important for us to continue. I think that we now need to increase on the basis of what we are seeing. We need to increase and make sure that there are more beds than we might have over the period anticipated. This is so because we had a kind of a sense that the lockdown was able to give us space to be able to improve our health services, but we have actually seen that the numbers driven largely by the Western Cape numbers, that's going to become a challenge because with the loosening of the lockdown and loosening in reintroduction of economic activities in the various parts of the country, the numbers have started to increase. Those increases mean as well that a lot more responsibility has to be taken by each and every one of us as individual South Africans. The key weapon that we have to be able to deal with COVID-19 is ensuring that everybody wears masks, and we're encouraging people to use fabric or cloth masks. So when you leave your house, let's make sure you use your mask. We're also encouraging everyone to understand now the need for distancing. Where you've got meetings, there must not be too many people, and in this case we'll put a figure of 50. But where you are working, where your day-to-day interaction, you must try and keep a distance, and we always recommend over a meter, say 1.5 meters or more, which is where our records have indicated that that's when the effectiveness of the distancing happens. The frequent washing of hands and the use of sanitizers is also critical in dealing with the containment of this infection. It's also very important. I think the issue of wearing masks is also very important. I think it's important for people to know that in the first instance, the most concrete research has shown that the mask is a lot more effective if it is worn by someone who's got an infection from spreading the infection to the next person. But if both the infected person with symptoms and the one who's nearby, if both are wearing the mask, even the risk is much lower. But the mask on its own is not adequate to stop the infection, because the hands can also contaminate, can touch contaminated surfaces. The hands can also touch your parts of the body where the contamination easily happens. It's also therefore important that the sanitizing our hands, washing our hands is as important, especially if you want to be handling doors, if you're handling utensils, if you're handling surfaces. Everything that you handle could have actually been contaminated with someone who was infected. So it's important. But the other issue then is that if you're using your mask, let's always assume that if you're using the mask as it stands, that the inner part of the mask could well be contaminated. So if you take it off and give it to someone else to hold or touch your inside of the mask and so on, that is potentially also causing a problem. So it's important, therefore, that people must use the mask properly, fold it properly, and then at the same time, the use of the mask is also important. That some people just put it over their necks, and that's not good, because the contamination and the infection really comes from the mouth and the nose, and therefore some people put it just on the mouth and not on the nose, and all of that is things that people need to understand. I've walked around in some of the areas and people don't have their mask, and you ask them, "Oh, where's your mask?" And they say, "Oh, I've got it in my pocket, or I've got it in the bag." And so on. The presence of the mask is not the solution. It's the proper wearing of the mask that's part of the solution. And then the rest of the other containment measures are very, very important. So this is what message we would like to send right across. Now, obviously, as we say so, we are going through a number of things that need our cooperation. Schools have been opened. We need the understanding and the cooperation of parents, of teachers, of everybody, of society as a whole, because we ultimately have to get the schools to open. It may not be all at the same time, but we need to slowly get to a point where we're bringing a degree of normality. It's a difficult issue to say when there was when there were fewer infections, fewer positive cases, we ask for a lockdown. And when there's a huge number of infections, we say people must go back. Actually, there's no contradiction. What actually happened at the beginning, the rate of the infection was very high. And that high rate of infection was driven largely by imported cases. And what we needed to do was to actually break that trend. That we have successfully brought that, we've brought broken that trend. But we now have to continuously fight this, this curve, try to flatten it. So it's not a once-off issue. It's going to happen every day. And as it happens now, we've seen how the lockdown did not assist us in the Western Cape. Not that lockdowns don't work, but in fact we need now to say how do we make sure that we can close the loopholes that actually arose in the case of the Western Cape. Because as we are now loosening and going back to normality, a lot of mixing of people is going to actually make sure that the infection spreads. People who are sitting together are going to be spreading the infection amongst one another as clusters, outbreaks, and so on. We've seen that already happening. So we are going to be struggling as we move forward. But what's important is to actually deal with the questions of how do we screen our people. People who have got symptoms, they should really ideally not even be going into some of the activities such as their workplace and so on, or even church and so on. Now, we had initiated a number of restrictions before the real lockdown happened, which is when we had actually talked about the 50 people in a meeting, and also the distancing and so on. That is now the normality that we have to get back to. Now, obviously, government will find that people are going to be criticizing it because everyone is now looking at their own constituency, their own interest, their own area of focus. But at the same time, we are very appreciative of the understanding of the church leaders, that those who have got huge churches who have said that they would rather delay the reopening of the churches. It's also created a new way of worship where people are worshiping online, and they're quite happy with that. And of course, we think that it's one of the benefits of this situation, that people have explored different ways of doing what they normally did differently. But it also means that in our cultures of how we do certain things like funerals, some other social situations, we need to approach them from a very different angle as well. So we have then continued to encourage people to come forth with their symptoms, and we do the testing and then the management. We have worked very closely, our Ministerial Advisory Committee. We've made sure that case management we try to standardize as much as possible across public and private sector. And we have also been in touch with a number of other international bodies, as it were, of the major drugs that are being looked at for participation in the therapeutic trials, such as remdesivir. We've been in touch now with the company that is responsible for its development, and we're hoping to work together to get some of those compassionate donations that tend to come through. So we will be working with UNICEF in that regard, and our SAPRA is already working on how to fast track the conditional licensing of the drugs for use under supervision for trial purposes. So that work is actually already ongoing. We've also noted that on the use of chloroquine, WHO has discouraged the use of chloroquine because of some of the findings that have come through. So we will continue to follow that aspect on the use of various therapeutic agents that are being worked on. We are also, on the one hand, working very closely with various other manufacturers to try and source more of our diagnostic kits from all over the world. We had not anticipated the constraint to be the extent to which it was, but we nevertheless do want to indicate our appreciation and the fact that we want to commend all the workers, health workers, particularly on the laboratory side, because we've reached across public and private, we've reached a hallmark or a landmark of 1 million tests that have been conducted. It's really been a lot of hard work. It also meant that a lot of people were working overnight. People were working over weekends. They've sacrificed their leaves and so on. We do want to extend our appreciation to all those who are working on the laboratory services. In particular, we have also been aware that some of them have been tested positive. We understand their sacrifices, and we really want to continue to give them support. The issue that's been raised around backlogs, we continue to manage that issue. In particular, we have been able to focus on reducing drastically the backlogs in the Western Cape, where our biggest challenge was because we need a quick turnaround time there. We need a lot of quick movement so that people can be taken out for isolation and for quarantine and for for treatment, so that people under investigation can be quickly decided upon whether they will be released to other wards, they'll be released home, and so on, based on whether their results are positive or not. Otherwise, that begins to clog up a number of beds. And so there's been a lot of good work there, and I've been very pleased to see that the turnaround time, particularly in the Western Cape, has been reduced to about 24 hours, which is good. And so I want to thank the laboratory teams for the work that they've done there. And I must also say that it's largely been done through the public health services. Those are the ones, I've seen some of the reports that suggested that this was a relief that we got from the private sector. It's actually not correct. The truth is that we have targeted Western Cape to be able to deal with the issue of the backlogs. We're now focusing on the Eastern Cape. We have also dealt with the Free State, where those backlogs were dealt with, and obviously with a more better targeting, which we need to really now emphasize on all our clinicians, and that there has to be much stronger targeting, ensuring that everyone who needs treatment, everyone who's under the care, and those who are particularly the health workers, make sure that of debate.
All right, it seems that we have some issues with regards to the pictures that we're receiving there, but you have the Health Minister, Dr. Zweli Mkhize, talking about where we are in the fight against COVID-19, but specifically, he was talking about what's happening in the Eastern Cape and talking about this EMS scooter program that he's there launching together with the MEC as well as the Premier, and talking about that they did anticipate the rise in COVID-19 cases generally in South Africa, and talking about the number of beds that have been increased, the field hospitals that have been set up. And he did mention that the number of patients who need hospitalization have increased in the Eastern Cape, the Western Cape, and Gauteng. Earlier on, you heard from
results become between the that advice no patient is discharged when the sure that results are expedited, so that there should be no one whose health is compromised. But I want to consider this issue of for the initiative of the President. We've initiated an AU pool procurement platform. We're working on that platform to access some of the suppliers who over the years have supplied us, but because of pressure, they may not have been able to do so. We're now taking advantage of the economies of scale that the African continent is able to utilize. The President, has launched this particular platform, and we will be using that to access more. We will be using that to access more and more test kits, and we'll also be using it for future to make sure that there's equity across the African continent in the supply of the various commodities that we require. So from that point of view, I once again want to also commend our Health Products Regulatory Authority. They have worked very hard to license everything that seems to be available on this earth, to try and see what is suitable for us. Their report indicates that they've done almost 200 test kits that they've tried to evaluate. I know that they've worked overnight, over weekends, overnight, and under lots of pressure, and they've done a lot of good work, and they've released a list of those which can be used for validation, and I will continue to support the regulatory authority as well as the laboratory services to access as much as possible any of those diagnostic kits that would be useful for the public, for us to be able to manage the COVID-19 situation. So again, I think our teams have done wonderful work. I want to commend all those health workers in the hospitals, in the communities, the community health workers, the various professionals, the doctors who have come on board and assisted and worked with us as we're dealing with this issue of responding. I want to say that we need to remain strong, we need to remain focused. We haven't quite got to the peak. We still got quite a lot of difficult days ahead, and we must really brace up and face the fact that a lot more is going to be demanded on us as we care for our people, and that we must be there and ready to do whatever is necessary to save the lives of our people. We will continue to give support to the various provincial leaders, the provincial health management teams. We also want to thank them for the work that they've done. Such initiatives as what we're seeing here, I moved to all the provinces. I can tell you, even the managers in health don't sleep. They work throughout the day and night. We get reports to every day. We talk to them every time of the day or night. We just always want to make sure that whatever needs to be done, we are able to answer to the call of our people. We also want to see what assistance we can on the spot. Like yesterday, we were to sit with the MEC to solve some of the problems of the team in one of the hospitals, Butterworth Hospital, that has been known for a lot of negative things, and I'm very pleased to see that there's an effort to turn it around. And in this case, we have resolved to be able to put in a number of additional people in place, the posts for managers, for various professionals, for doctors, and we would like our management teams in the provinces to be very active, to focus where there are pressures that are being reported, particularly because we've got a dispensation that allows us, quick employment of people, and in that case, we should be able to appoint people within a short space of time in response to the COVID-19. And so we want to say thank you for the work that is done. We continue to visit various provinces. I've got a report from the Deputy Minister who's sitting out in the Western Cape, and we have decided we're going to have a continuous focus there together to reinforce our team that's sitting in the Western Cape, that more people are being taken out for isolation and quarantine. And we need to persuade members of the community, because it has also come to our attention that some of them are not willing to go for quarantine. I know this is the minority of instances, but we just want to say to our people, let our community leaders on the ground, in the wards, in the churches, in the civil society, in the traditional leadership, traditional healers, everyone work with us to encourage people to, align themselves with the processes of fighting this COVID-19. So we will continue, therefore, to monitor what's happening in the rest of the country, and then continue to give our reports to our leadership at the national level. The work that's been done by the President and the ministers and the national departments as well needs to be commended, because they have to focus on the rest of the aspects of what it means to fight COVID-19. Is not just about health, it's about humanitarian issues, it's about water, it's about sanitation, it's about making sure people can get back to work, it's about making sure that they are safe. It's also about making sure that we can attend to the issues of education, we attend to the issues of gender-based violence, we attend to the issues of crime. All of this together means that we really have to do our best to try and manage our people's lives as we are focusing on COVID-19. No other part gets neglected. So we're going to then get the final briefing with the team here in the Eastern Cape. We have said yesterday that whilst we can see that they're doing lots of work, we'd like them to pick up speed, because the numbers that we are seeing here must actually, they must always be moving ahead of the curve. And therefore, the issue of continuous, screening, isolation, targeted to various areas need to be dealt with. We have also opened up an opportunity for private sector collaboration with not only the private hospitals, but also with the private general practitioners to be enrolled to support us, as well as some of the specialists. We'll finalize all of that, and therefore we want to say, from the point of view of national government, we need to be working very closely at a district level to strengthen our response. And I've said that what the president has done to say all the ministers and the deputy ministers and senior officials must go and work in the district. It's important to flatten this structure. Flatten it so that everyone is nearby and give support at the level where they need to be able to do that. And it's all about saying that we must all work as one team of government and work together. But we also need government and society to work together. Civil society, business, religious, traditional, all the leaders must all work together. That's the only way we can fight this COVID-19. But ultimately, each and every South African needs to take a decision that they are going to be part of this fight, and as being part of this fight, each must take individual sense of responsibility. It is fine to correct each other and criticize each other, but let's look more at how we can support each other. That will give us a lot more, synergy as we move forward. And so I think what's important for us is to say each individual needs to know, if you put on that mask, it's about you, it's about your family, it's about your neighbors, it's about society. It's about making sure that you are not the source of spreading the infection. It's also about making sure that you are not the next person who must be cared for because you have now got the infection. So it's important that when we say sanitize your hands, wash your hands, you for your own health, you do so for the health of others. And this is how South Africa has been built. It has been built on the basis of solidarity. It has been based on the basis that we would like to create a compassionate and caring society. And this is what, if anything, COVID-19 is reminding us of, that we are a society that really is caring, that is compassionate, that really respects each other's rights, that respects the fact that every one person needs to be able to, survive on the basis of others. It's about Ubuntu, where we say I am because of others. It's about ensuring that you do things not because someone else has asked, but because it's good for you to make that contribution, to make people to be better humans because of your own contribution. That's really the request we have, and therefore we want to thank the media for all the interest that you've got on this matter, and I really believe that your interest on the matter has really helped South Africans to understand this situation, and I hope that we'll continue with this partnership. Yes, we have to be able to face up to issues. Sometimes, it's difficult to avoid sensational stuff. Sometimes it's difficult to avoid that angle and that angle. But I think we mustn't veer away from the real core of the message, and therefore we can defeat fake news, which is what really would be a big dampener in fighting this COVID-19. So with that, we want to say thank you very much for being part of this launch in the Eastern Cape, and really we hope that we will see this kind of initiatives growing in the different parts of the country. Thank you very much. Let me hold it at that for now, and I'm sure I've answered all your questions.
No question.
I'm sure you don't have questions.
There can be.
You do? Okay.
Let me give you just 2 rounds.
Minister, Maldo Teman from News 24. I just want to know, you mentioned that the virus not the virus, but the reopening of the economy and loosening of the education did not help to slow down the spread of the virus. Perhaps what do you think needs to be done there to prevent that? And also, there were calls from many people that perhaps the schools were reopened prematurely, as recently demonstrated by the shutting down of schools with the East London alone having shut down 31 schools. What's your take on that? Last question. What other diseases give you sleepless nights besides COVID-19? Is COVID-19 the #1 killer in the country at the moment? taking into consideration that long before COVID-19 there was AIDS and tuberculosis, which was killing people in their hundreds, thousands a year. I'll end there for now.
Is there any other question?
From me as well.
And involved in this matter, JJ, SABC?
I just want to find out how many are these bikes in total?
Please, the matter, JJ.
For me, Minister, there seems to be still a fear among healthcare professionals with regard to the spread of the virus in their work environment. There seems to be an obsession for fumigation. Can you please explain this fumigation obsession and maybe get the message across with what is actually has to be done if infection in a health facility? Yeah, that's all.
You're referring to confirmed cases, not infection? Okay. Over to another news.
Thank you very much. A crisis comes a point where you may do something and you are said to be wrong, and you don't do it, you also are to be wrong. You are blamed either way. That is usually because there comes a point where the levels of anxiety, concerns begin to raise a lot of contradictions in society. Society are people who have got very different interests. So when we start the issue of the lockdown, I can recall because we made the first presentation to the National Command Council, and we put up 3 points. The first was we have to lock this down. And we lock it down because we need to, we need to stop the virus from spreading, and therefore to stop the virus from spreading, you need to actually stop people from moving. The rate at which it started was going to be very fast, and so it was very, very important that. But then we said the second issue that we need to take into account is that there are going to be social issues of concern that we must take into account as soon as we think we have benefited from the lockdown. These are our challenges, and this relates, for example, to issues such as hunger, such as restriction of the normal societal activities. People going to church, people going to meetings and having big weddings and so on. Those issues we would have come across to us as challenges at some point. The third one was rescuing the economy, which was deteriorating. There is no wisdom in saying you can end up with everyone staying at home and there's no infection that is spreading, but everybody is dying of hunger and the economy is crying to a halt. The problem is how to then balance it afterwards. And this is really what we're struggling with. And as we do so, I think we must accept that those who are going to behave about certain steps, that those who are not going to behave about certain steps. There's a lot of consultation that goes into it. And when we do consult, we'll get one aspect right. And whilst we think you've sorted it, we have actually created a lot of opposition from another sector that just feels that you shouldn't have bothered about that sector. And that, people have got various views. So the role of government is to always try and manage a balance so that we can get along despite our diverse interests and diverse impact of some of the things that we do. So I would still say we were quite right with the lockdown. And I also want to say the lockdown did give us benefit at the time, and when the lockdown happened, it was bound that it was going to hit on the issues of hunger, of social tensions, on issues of the economic recovery, and all of that. So we have to now start to manage from the point of view of what balance is the correct balance that can allow us to reduce the spread of the infection time allow economic activity. As it turns out, all the areas which are high tension areas are the areas where the highest amount of economic activity is being generated. So if you want to actually continue to close the high transmission area, that means that the 80% of the economy would actually be affected. So that's the balance that the government is trying to navigate the country through, and that's why it's important to always work together in this particular case. The schools were we right to open the schools. We have to start somewhere. I believe that it was important is to be able to say, indicate to society that we start to open up the schools. And in the process, these are the requirements that we need to try and put in place. That some of the schools would start seeing infection, we knew. That in some of the areas we might have to close the schools down. That in some of the areas they might not be able to open immediately, we knew. But you can only know what the situation is when you actually work together and try something and then try and move on. Now, most of the parts of the world have had to go through this. I've got an example here of in Wuhan, they locked down the place for almost 50 days. Then they went for probably about 30 days without any one case. But soon thereafter, they started picking up new cases. They went back and locked it down again. Germany didn't lock down. They went on and on, but somewhere along the line, they suddenly realized the numbers were getting uncontrollable. They started putting lockdown. Iran had actually done a lockdown and eased it off. And then everyone was happy, and they thought everything was fine. And all of a sudden, they started seeing that the numbers moved from something like 700, and they went up to over 1,000, and then they started shutting down again. So there are going to be areas where we're going to be forced to stop and start and stop and start. I think we must just understand we don't want it like that, but we might be forced by the situation. And when that happens, it's not because government is failing to manage. It's just because under the circumstances, there will be schools, there will be a concern, and then you can maybe have to do something about it and then go back. The first school which I had to address was on the time when we were the first case. We didn't ask the teachers to close the school. They just went and closed it. Everyone was very anxious. Then we had a meeting with the parents, and it turned out that no one really in that school was actually tested positive at that time. But the anxiety was a very big problem in this case. So when parents are nervous about what's going to happen to your children to school, it is correct that we must accept will be anxious. And it's also important for us to say the kids to be infected. We're trying to get the best way of returning to normality without many people getting affected. It's very, very important to understand that whilst we're trying to,
Dr. Zweli Mkhize in East London, the
civilized society might actually increase the rate of the infection. And when that happens, we must also accept that it is not the intention to collapse the economy when we lock it down. The intention is to stop the infection. And when the infection is still increasing, we open up the economy. It's not the intention to spread the infection. The intention is to try and get the economy to be activated again. The balance is a very difficult balance. And we must accept the government is not the only on that matter. So we will take the views and work together with whoever has ideas. Now, you've reminded me of something that I've learned now, that it doesn't matter. You can actually explain something, but if the journalists had that question, they will ask it, and you must answer it again. And this is what we have now done. So I'm going to answer it again. We have many diseases that cause ill health and mortality more than COVID-19. COVID-19 has become a problem because it's a new disease that human race is not accustomed to, that's got no immunity against, and there's no treatment. And the fact that it spreads very fast is really the one that's caused a lot of concern. The fact that today the whole world has got over 7 million people affected, and that in South Africa every day where our numbers are increasing, and the fact that it has actually created increased mortality in a number of countries is the reason why everybody is anxious about it. Tuberculosis has still got more people that it has killed, and diabetes and cardiovascular diseases. But because we have been used to these diseases, but because we have also got treatment for them and you can cope with them, it does not appear as though it's a big issue. Actually, it is. By the time we get to the end of the year, you will find that the number of people who have died from COVID-19 will still be less than the numbers who have died from all the other diseases. So that's the point which I was making when I was saying we will not lose focus on the rest of the healthcare system. We will not lose focus on the need to attend to HIV, antiretroviral treatment, anti-TB treatment, dealing with the diabetes, cardiovascular diseases, cancers, and mental health, and unnatural causes. All of these things are very, very important for us to combine, and that's why I'm saying, as we deal with COVID-19, we deal with it in such a way that we combine the systems to be able to respond to COVID-19 and still deal with the others. So the reality is that there are many more causes of death, and those causes of ill health have to be managed together with COVID-19. Just that COVID-19 is really occupying the mind of the whole global society, and from that point of view, we have to talk about it. Until it stabilizes to a situation where we can use our vaccines to deal with it, we'll always have a problem. So from where we sit, we must say, if we don't focus on COVID-19 to the extent, I'm sure the media will be asking us, why are we ignoring COVID-19? If we focused on the other, on COVID-19, now the question, why are you not focusing on the other? It's not true. We're focusing on everything. I think we need to understand that we have to keep a balance. But you can't talk about both, and then, each time you raise this one, now why not talk about this one? You have to keep, giving each one attention at the right time. Then the fear from health workers, well, that's real. I think if each one of us were expected to go and deal with, an infection such as COVID-19, you would have anxiety. And I think that when we talk about our health workers being anxious, that's really based on the fact that you have to take COVID-19 seriously. But we also are saying that there is adequate training that would make sure that the health workers are safe from COVID-19. We need to make sure that each and everyone has got that training. There is also adequate protection that will make sure that everyone can be protected against COVID-19. So you can actually walk into an area where some people have got COVID-19, be well trained, and therefore be well protected. You look after them. Through the protocols that we use, you can walk out and go to your family without any risk of contaminating or infecting your family. So it is actually possible. Where we realize that there is anxiety, it's usually based on poor communication, it's based on not adequate training, it's based on sometimes not adequate protection, protective clothes. So we are trying to correct all of that so that our health workers must always know that there is no health worker who will be thrown into a situation where they look after COVID-19 patients and they are not well trained, not well protected. We're going to work on that continuously. Then, of course, there's been a history of fumigation. It comes a long way with the health services where there would be, if there's been a very infectious case in a particular ward, you then close it down. There'll be a particular way of fumigating it, and then you give it so many days, clean it up. Now, a whole debate has come up whether, in fact, those are effective or not against the virus, and some people will still like to just make sure, and others would like to say, well, look, maybe it doesn't really make any difference. I wouldn't want to make a lot of comment about it. I would just say that we have asked our teams to actually, the advisory committee, to help us to put clear guidelines and protocols that are going to stop the debate so that we have a consensus on the best way of dealing with these issues. If we've been to some of the areas, you see the taxis are being fumigated. We've just last week seen a situation where there were these fog tents where you walk in and it sprays onto you. And we asked our team to say, look at this, and they've got serious concerns about that. So we are waiting for our Ministerial Advisory Committee to come out with protocols just to standardize this issue, because some of the issues will catch up with us where certain practices overlaps with the new situation that's developing, and then with time we'll have cleared it and then we'll move on. So I would just say that we will get proper guidance on how to ultimately deal with it. That matter is under discussion, and therefore there's been quite a strong view to say maybe some of this fumigation it need not be as how it's done. And I've said that's fine. Let's get a proper guidance, and therefore we'll get everyone to be out there to deal with it. Both the issue of human fumigation and the facilities, the vehicles and all of that. Let's just say we will actually get all of that matter, those matters dealt with without any further confusion, as it were. On the one hand, we just want to make an assurance to our own health workers that we will always make sure that they are protected as they go. I was pleased to see that even in this province, where there have been calls for hospitals to close, the Department of Labour, the Health Department has interacted with the Department of Labour. They've provided the necessary funds that they were called for. They've engaged the labour unions, and they've created the occupational health and safety committees. They've now made sure that the issue can be dealt with rather collegially and collectively, and so we will be hopefully seeing less and less of the challenges. We have said that occupational health and safety committees must go and inspect the PPEs. Are there enough PPEs? And when they are not, we'll just make sure they're provided. We will always make sure we provide as much as is possible on the PPEs. The question of these scooters, motorbikes, the MEC is waiting to give you that answer.
Well, mine
Minister Dr. Zweli Mkhize and Health MEC in the Eastern Cape, Sindisiwa Gomba, addressing the media there on the fight against coronavirus, the launch of the contact tracing and multidisciplinary approaches to trying to deal with COVID-19 in South Africa. One of the points that the minister made a little bit earlier on is that the lockdown is not a set thing, and perhaps if things get worse in certain areas, they may go back up to different levels, which is what the president has also said to us. Busisiwe Jemsana is following that story, and we'll get a comprehensive update from her later on. Let's continue the bulletin. After a series of go-slow...
Because whilst we thought about rural areas, we're now seeing urban areas saying we also want scooters. And we thought, well, urban areas are better off than rural. It might actually force us, if it works well, and I'm hoping it does, that we can extend it to some areas.
How much are they costing you?
Well, you know, most I'm a politician. And because of the PFMA, I normally do not get into health field. If I would know the price right now, then it suggests that I have something to do and understand the processes. The CFO is in the room.